A little more than half a tablespoon of olive oil each day. That's all it takes. In a study that tracked more than 90,000 people over 28 years, that small amount was associated with a 19% lower risk of dying from any cause compared to people who barely touched it. 19%. Not from a pill, not from a procedure, but from something already sitting in your kitchen right now. So it's no surprise you've been seeing it everywhere. Drink olive oil before bed and see what happens. And maybe you've asked yourself, is that actually true or just another internet gimmick? Here's what I'm going to do for you over the next few minutes. I'm going to separate the part that's genuinely supported by solid science from the part that's pure fiction, because both are tucked inside that one sentence. And there's a twist. Most of these videos never mention a reason why the before bed part specifically can actually backfire for some people, especially as we get older. Stick with me, because that twist is the difference between this helping you and quietly working against you. I'm not here as your doctor. I don't know your medical history, your medications, or what your heart is doing tonight. What I can do is walk you through this carefully and honestly, in a way you rarely get during a rush 10-minute appointment, so that when you do speak with your own doctor, you're the most informed person in the room. Let's start by clearing something up. You've probably been told that drinking olive oil at night does something special because it's at night. That while you sleep, it melts belly fat or flushes your liver or detoxes your body overnight like a little cleaning crew working the night shift. That's the part that isn't true. There is no good evidence that midnight is a magic window or that a spoonful of oil detoxes anything. Your liver and kidneys are your detox system, and they don't clock in at bedtime waiting for oil. But, and this is the important part, the benefits of the olive oil itself are very real. They're just real all day long, not only at 10 p.m. The magic was never in the clock. The magic is in the oil and in the habit, and in one thing almost nobody mentions that I'll get to. So don't let the silly version make you throw out the good version. That would be a genuine mistake. Why does any of this matter enough to spend 20 minutes on? Because the things olive oil has been linked to are the exact things that shape how the second half of life actually feels. Heart attacks and strokes, the slow stiffening of arteries, the kind of memory decline we all quietly worry about. In that 28-year study, higher olive oil intake wasn't just tied to living longer overall. It was tied to a lower risk of dying from heart disease, from cancer, from lung disease, and this one stopped me. A 29% lower risk of dying from a brain condition like Alzheimer's or Parkinson's. A separate analysis put the lower risk of dying from dementia specifically at around 28%. These are associations, not guarantees. I'll be honest about that throughout, but they point in a direction worth understanding. If clear, no drama health information is what you came here for, the honest version, not the hype, do me a small favor and hit subscribe and like. It genuinely helps me keep making these for people who'd rather have the truth than a miracle. Now let me show you how this actually works inside your body, because once you see it, you'll never look at that green bottle the same way. Again, think of the inside of your arteries as a smooth, non-stick surface, like a good non-stick pan. When everything's healthy, blood glides across it and nothing sticks. But over the years, damage and inflammation scratch that surface. And once it's scratched, things start to catch and cling. Cholesterol cells, sticky buildup we call plaque. That plaque is the raw material for a heart attack or a stroke. So one of the biggest jobs in aging well is protecting that non-stick surface for as long as you possibly can. Olive oil helps in two ways. First, it's mostly a fat called oleic acid, a monounsaturated fat, which is just a fancy way of saying it's the gentle, artery-friendly kind of fat, the opposite of the hard, sticky fats in butter and processed meat. When you use olive oil instead of those fats, you're swapping a fat that roughens the pan for one that helps keep it smooth. Second, and this is the beautiful part, good olive oil is full of tiny plant compounds called polyphenols. Don't let the word scare you. Polyphenols are just natural protective chemicals the olive makes to defend itself. And when you eat them, they act like a small antioxidant cleanup crew, mopping up some of the damage before it can scratch the pan. One of them has a name worth knowing, ulocanthal. Researchers found that oleoanthal behaves in the lab a little like ibuprofen, the anti-inflammatory painkiller. Not as strong, not a replacement for medicine, but it nudges the body's inflammation dial in the calming direction. And here's why inflammation matters so much as we age. Picture inflammation as a thermostat inside your body. A little heat is good. It fights infection and heals wounds. But as the years pass, that thermostat tends to get stuck slightly on, running a low, constant background heat that never quite switches off. Scientists even have a nickname for it, inflammaging. That low simmering heat is tied to stiff arteries, achy joints, and a foggier brain. Olive oil's polyphenols are one of the gentle hands that can ease that thermostat down a notch. So that's the mechanism. Better fat protecting the non-stick lining of your arteries, plus little antioxidant compounds turning down the background heat. That's the real engine behind those big numbers. But now, here's the twist I promised you. The part that actually changes how you should use this. The single most important factor in whether olive oil helps you is not the time of day. It's not whether you drink it at bedtime. The hidden driver behind every one of those study results is this consistency, quality, and what the oil replaces. The people who benefited weren't performing a midnight ritual. They were people who used real olive oil every single day in place of butter, margarine, and mayonnaise. That's the whole secret. The before bed framing is a decoy. It gets your attention, but it points you at the least important variable, the clock, while hiding the three that actually matter. And for some people, the bedtime timing isn't just unimportant, it's the wrong choice. Because lying down flat right after swallowing fat is one of the classic triggers for acid reflux. That burning sour backwash into the chest and throat that gets worse the moment gravity stops helping you. If you're someone who already gets heartburn at night, taking a spoon of oil and then lying down could hand you a worse night, not a better one. Hold on to that, we'll come back to it. Okay, let me give you the real, honest breakdown. The actual things that can happen when olive oil becomes a daily habit. Counting through them one at a time for each one, what it feels like, what's happening inside, and exactly what to do. Number 1, your digestion may move a little more smoothly. This is the one closest to the before bed folklore, and it's partly true. Olive oil has a mild, lubricating, stool softening effect. In plain terms, when there's more oil in your gut than the intestine fully absorbs, some of it coats and softens what's passing through, like oiling a stiff hinge, so the door swings easier. The research here is modest, mostly from studies in older adults and in kidney dialysis patients who struggle badly with constipation. And in those groups, olive oil helped gently with fewer side effects than harsh laxatives. What to do? If occasional constipation is your issue, a teaspoon to a tablespoon of olive oil, maybe with a squeeze of lemon to make it easier to swallow, can be worth trying. But please hear this. Go for water, fiber, and daily movement first because those fix the root cause. And if your constipation is new, getting worse, or comes with belly pain, blood, or unexplained weight loss, that is not a home remedy situation. That's a see your doctor situation soon. A change in bowel habits can occasionally be an early warning sign of something that needs real eyes on it. Number 2, your heart gets a quiet long-term ally. You won't feel this one. That's the point. This is the slow, invisible protection of that non-stick artery lining day after day, year after year. In a major clinical trial in Spain called PrimeMed, adults aged 55 to 80 who were already at high risk for heart disease followed a Mediterranean diet with extra olive oil added, and their combined risk of heart attack, stroke, and cardiovascular death dropped by roughly 30% compared to a low-fat diet. In that big long-term study I opened with, the people eating the most olive oil had about a 19% lower risk of dying from cardiovascular disease. What's happening inside? Gentler fat, calmer inflammation, a lining that stays smoother longer. What to do? This is a daily habit benefit, not a bedtime shot benefit. Get olive oil into your regular meals. And if you have a heart condition or take heart medication, this supports your care. It never replaces it. Do not adjust a single pill based on a food. That conversation belongs with your doctor. Number 3, your brain may get some protection over the years. This is the finding that surprised even the researchers. Higher olive oil intake was linked to that 29% lower risk of dying from neurodegenerative disease and around a 28% lower risk of dying from dementia specifically. Now, link 2 is doing honest work in that sentence. This is observational, meaning it shows a strong connection, not ironclad proof that the oil alone caused it, but it fits everything else we know. The brain is an intensely hungry, fatty, easily inflamed organ. And the same things that protect your arteries, steady blood flow, lower inflammation, tend to protect the wiring in your head too. What's good for the heart is usually good for the brain. What to do? Same as the heart. Consistency over gimmicks, and treat any real memory changes. Getting lost somewhere familiar, struggling with words, personality shifts as a reason to see a doctor, not a reason to drink more oil. Number 4, your body's inflammation dial may ease down a notch. Remember oleoanthol, the compound that behaves a little like ibuprofen in the lab. Some people with achy, stiff joints say a regular olive oil habit seems to take the edge off over time. That's plausible given the anti-inflammatory chemistry, but I have to be straight with you. A spoon of olive oil is not a painkiller. Do not swap your prescribed medication for it, and don't expect it to stop a flare the way a pill does. Think of it as a gentle, long game influence on that stuck thermostat, not an on-off switch. What to do? Enjoy the possible benefit. Keep your expectations honest. And if you're on any anti-inflammatory or blood-thinning medication, ask your doctor or pharmacist before you make olive oil a big daily fixture, simply so everything's accounted for together. Number 5, and this is the one that matters most. What the oil replaces beats what the oil is. Here's the finding that should reshape how you use this. When researchers looked at what happened if people swapped out about a spoon's worth of butter, margarine, mayonnaise, or dairy fat and put olive oil in its place, they saw meaningfully lower mortality, depending on the disease, somewhere between 8 and 34% lower. Read that again. The benefit came from the substitution, from taking out the harmful fat and putting the helpful one in. So think of it like this. If you add a spoon of olive oil on top of a diet full of butter and fried food, you've just added calories to a fire. But if that spoon of olive oil takes the place of the butter on your toast, or the mayo in your sandwich, now you've changed the whole equation. Same spoon, completely different result. That's the real secret hiding behind drink olive oil every night. It was never really about drinking it. It was about replacing something worse. What to do? Don't ask when should I drink my oil. Ask what fat can I swap it in for today. Number 6, the catch. The part these videos never warn you about. 2 honest downsides. First, calories. 1 spoon of olive oil is about 120 calories of pure fat. Wonderful when it replaces something. A slow weight gain problem when it's just piled on top. Second, that reflux issue. If you swallow oil and lie down flat and you're prone to heartburn, you may be setting yourself up for a burning, restless night, because lying down removes the gravity that normally keeps stomach acid where it belongs. For a reflux-prone person, bedtime is arguably the single worst time to do this. What to do if you get nighttime heartburn? Take your olive oil with a meal earlier in the day and stay upright for 2 to 3 hours after eating. And frequent heartburn several times a week isn't just an annoyance to manage with timing. It's worth mentioning to your doctor because ongoing reflux can irritate the esophagus over time. Now let me give you a couple of quick things you can do right now while you're sitting there. First, a simple quality check. The throat sting test. If you have some extra virgin olive oil in the house, take a tiny sip straight and swallow. Pay attention to the back of your throat. Do you feel a peppery little sting, maybe even a cough? That sting is ulacanthal and the polyphenols, the good stuff. A real fresh, high-quality, extra virgin oil bites back a little. A cheap, old, or heavily processed oil often tastes flat and greasy with no kick. This isn't a medical test. It just tells you whether you're getting an oil worth using. If yours tastes like nothing, you're probably paying for looks, not benefit. Second, a self-observation for reflux. Think back over the last couple of weeks after a fatty or heavy evening meal when you lie down. Do you get burning in your chest, a sour taste, or a cough that shows up at night? If yes, make a mental note and mention it to your doctor. It doesn't mean anything is wrong, but it's exactly the kind of pattern worth flagging, and it tells you bedtime oil is probably not for you. Third, a 30-second audit. Picture what fats you actually ate today. The butter on the toast, the spread, the mayo, the oil the fries were cooked in. Just find one One single fat that olive oil could quietly replace tomorrow. That one swap is worth more than any midnight ritual. Let me put all of this together with a story, and I want to be clear. This is an illustration, a let's imagine example, not a real patient. Picture someone. Let's call her Margaret, 68. Margaret sees one of those videos and starts knocking back a big spoon of olive oil every night right before bed, convinced it'll melt her belly fat while she sleeps. 2 weeks in, she's not thinner. She's miserable. She's waking at 3 in the morning with a burning chest and a sour taste. The house silent, propped up on pillows, wondering what's wrong with her. She decides olive oil doesn't agree with her and quits disappointed. Here's what Margaret got wrong. And it wasn't the oil, it was everything around it. She took it at the worst possible time for her reflux. She drank it as a magic ritual instead of using it as a swap, and she was adding it on top of everything else. So she got the calories and the heartburn and none of the real benefit. Now imagine she'd done it differently. She moves the oil to daytime drizzled over her lunch vegetables instead of butter. She uses it in a simple salad dressing instead of the creamy bottled one. Same amount of oil, but now it's replacing worse fats spread through the day. Nowhere near bedtime, no heartburn. And months later, at a routine checkup, her doctor looks at her numbers and is pleased with the direction things are heading and asks what she's changed. That's the version that works. Not because of a trick, because of consistency, quality, and substitution. The 3 things that were hiding behind the hype the whole time. So, here's your simple, honest protocol. Everything here is low cost and doable. 1, buy real extra virgin olive oil. Look for a dark glass bottle and a harvest date on the label and trust the peppery throat sting test. That bite is the benefit. 2, aim for roughly 1 to 2 tablespoons a day spread across your meals. It does not have to be at bedtime. If bedtime is easiest for you and you have no reflux, fine, but the clock is not the point. 3, replace, don't add. This is the golden rule. Swap it in for butter, margarine, or mayonnaise. Take one out, put olive oil in. 4, easy everyday uses. Drizzle it over cooked vegetables. Dip whole grain bread in it instead of buttering. Or make the simplest dressing in the world. Olive oil, a squeeze of lemon, a pinch of salt. Whisk. Stir a spoon into soup at the end. 5. If gentle help with occasional constipation is your goal, a teaspoon to a tablespoon with a little lemon can be worth a try, but water, fiber, and walking come first. And new or persistent constipation goes to your doctor, not to the oil. 6. If you are reflux prone, keep the oil at daytime meals and stay upright for 2 to 3 hours after eating. 7. If you take any medication, especially blood thinners or anti-inflammatories, check with your doctor or pharmacist before making olive oil a large daily habit. Not because it's dangerous, but because good care means everything gets counted together. And never ever start, stop, or change a prescription because of something you heard in a video, including this one. Here's something I'm curious about, and it genuinely helps me. The way olive oil helps shifts with age. Because as arteries stiffen, as that inflammation thermostat creeps up, as digestion slows, the reasons to care about protective fats change decade by decade. What's a small nice to have at 50 can matter a lot more at 70. So tell me, how old are you? Drop your age in the comments. It genuinely helps me tailor future videos to the people actually watching, and I read them. Let me bring it home. What actually happens if you make olive oil a daily habit? Number 1, your digestion may move a little more smoothly. Number 2, your heart gets a quiet, long-term ally. Number 3, your brain may get some protection over the years. Number 4, your inflammation dial may ease down a notch. Number 5, the big one. What the oil replaces matters more than the oil itself. And number 6, the catch. Watch the calories. And if you're reflux-prone, keep it away from bedtime. The drink it before bed ritual was always a decoy. The real payoff comes from consistency, quality, and substitution. A real spoon of real olive oil most days in place of something worse. That's it. That's the whole honest secret. And you can start today with the next meal you eat. One last thing, and I mean it. This is education, not a prescription for you specifically. Your body, your history, and your medications are unique. So bring this to your own doctor and let them help you fit it to your life. If it was useful, subscribe and hit like, and I'll see you in the next one. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor or qualified healthcare provider before making changes to your diet, medications, or lifestyle.